both at ground sections and also demineralized sections, and also look at a late bell stage, because we'll be looking at a little bit of dentinogenesis. So if you look at the late bell stage, have the cervical loop right there, and as we look over this slide, of course, we'll have the thickest dentin and also enamel up here towards the cusp. So as we move back down here, we can see just a hint of that cell-free zone right in that area, and you can see those odontoblasts starting to differentiate from the dental papilla. So as we go up to the high dry, there are the odontoblasts. And as we come up and get this focused, we can see the predentin and the dentin. There's the enamel beginning to form. And you can see the dentinal tubules. And as you go along these slides, if you use the fine adjustment and turn down the iris diaphragm a little bit, you might be able to pick up some individual odontoblastic processes. This section is rather uneven, so I have to keep on adjusting the fine focus. Anyway, there are the odontoblasts. And note that those nuclei are away from the forming front, because all that synthetic machinery would be towards that predentin. Lots of dentinal tubules right here, and you can probably even pick up a few of the places where they are branching. Okay, well, that's dentinogenesis. So as we look at the mature tooth, that tooth in situ, these are demineralized, and so the, oops, that's the wrong one. The enamel will be gone. Here's the apex of the tooth. And as we come up here, we can see predentin. There are the odontoblasts. Here's the rest of the pulp. And then right along here, and I don't know if it shows up very well on the screen, but you can just make out the lines of von Ebner and realize that these go around like a tree ring. So these are incremental lines. They're going up in the long axis of the tooth. So we have a number of lines of von Ebner right in here. And sometimes, when you will see that on another slide, as you get up towards the crown, sometimes they show up a little bit better as they curve around the crown. But we can see the dentinal tubules and realize that those lines of von Ebner are just about at right angles to the dentinal tubules. So there's the predentin, dentin, and again there are the odontoblasts. And it looks like we have a few cracks in this slide. And just make out those lines of von Ebner. They will show up better on some slides than other slides. Now in some of the slide boxes, there are some of these slides that came from a study up in the perio department. And there's that pulp again. The pulp in these slides is very well fixed. And right there, we've got some tertiary dentin. I have two examples of tertiary dentin up on demonstration here, both in a ground section and also in a demineralized section. So there is some tertiary dentin right there coming down into the pulp. And as we look around this slide, right here we can see those lines of von Ebner again, right where it goes around and curves around that crown. And as we come down towards the apex of the slide, you can see these lines of Owen, which are nothing more than accentuated lines of von Ebner. And more lines of Owen right there. Also on these slides, you may find some osteoclasts along the alveolar bone. Okay, well, line of Owen there, line of Owen there, there, and also there. Lines of von Ebner, very delicate in this slide, and I doubt that they show up on the computer screen. But we also see some globular dentin being formed right in there. Let's look at the other side. A little bit more distinct on the other side here. We see some globular dentin. So that's chalcospheric mineralization. Okay, so if we look at a demineralized section, or a ground section, we get a little bit different view here. And right off the bat, we see lots of ground and lots of dead tracks. In fact, we have a little bit of attrition right at the cusp. When we follow those dead tracks down, and there's some more tertiary dentin. If we go over towards the CE or the DEJ, right there, that would be the mantle dentin. And we come into the circumpulpal dentin. So this and the mantle dentin, that's primary dentin. And then right there, that's the secondary dentin, where it makes that sharp turn. And this kind of shadow that we see right along there, that would be the line of demarcation. Really not much of a line at all. So lots of dead tracks. Secondary dentin, and we've got some tertiary dentin up here. And as we come down, let's go down to the root. More dead tracks. And then right here, there is Tome's granular layer. Kind of sandy looking. That's Tome's granular layer right underneath the hyaline layer of the cementum. So there's Tome's granular layer. And the other thing we need to find would be the interglobular dentin. And you may need to turn down the iris diaphragm a little bit. And right there, those little holly leaves that kind of almost sparkle a little bit. That is the interglobular dentin. And the concavities of those, like right in here, that's where you would find the globular dentin if you were looking at a demineralized section. And normally you find these in the circumpulpal dentin up in the crown. Sometimes, but not very often, down in the root. So we have all of those structures. There's the DEJ again. And we'll take a look at one other slide. And this particular slide is a little bit unusual. Here you can see both the globular dentin and the interglobular dentin in between. So this tooth was really not very well mineralized when that section was cut. So interglobular dentin and then the globular dentin. On a lab practical, if it is a ground section, then the question to ask would be, or the answer to the question would be interglobular dentin. You really can't see the globular dentin that well in a ground section. Okay, and there's Tome's granular layer there again. Okay, and I also have a couple of demonstrations up in front here. I have some stereo pairs taken with the scanning electron microscope showing a dentinal tubule, and I have a stereo viewer. And the stereo viewer is this small pair of almost like glasses. It has two prisms. The prisms go towards the micrograph. Put them on the bridge of your nose and stand back about 3 feet, right on the line of the tiles, and look right in the middle of the two stereo pairs. We have one above the other, or one below the other, whichever you prefer. And take a look at that. And as you look at it, you may have to back up a little bit, get a little bit forward. You taller people are going to have to probably squat down a little bit because I put these up. okay? And you ought to be able to get them to fuse and see a 3D depiction of that dentinal tubule, and see that some of those collagen fibers kind of bridge the gap almost. Although this is a ground section, it was slightly demineralized to get rid of the peritubular dentin. So that's gone, so all you see really are the collagenous fibers. Now, if you can't get this to work for you, and I can give you some help with this, I also have another stereo viewer with a couple of printed out from a PDF file, pictures of the same thing with a stereo viewer that's a little bit easier to use. So if you're rather klutzy and you can't get this to work for you, I've had the other stereo viewers. This is not like the magic eye that you used to look at in the newspaper. Okay, these are two stereo pairs. And so it is possible to take them side by side and cross your eyes and get them to blend. Some of you may have done that. Have you ever looked at the sausages between your fingers? Has anybody ever done that? I'm surprised that some of the people have never done this before. If you put your fingers together and stick them out in front of you and then look over the top, don't look at them, but look over the top, you'll see that it looks like linked sausages. Okay. Then if you pull your fingers apart a little bit, it looks like one's floating right in there, right in the middle. How many have never done that?
What?
Oh, that's surprising.
I've done that.
Can you take your thumb off too? All right. When you have grandchildren, you have to learn these things so you can entertain them. Okay, so if you want to look at the stereo